Coronavirus is declared global emergency by World Health Organization as outbreak continues to spread outside China.
Here's a summary of the article.
Coronavirus has been declared a global emergency by the World Health Organization, as the outbreak continues to spread outside China. The main reason is not what is happening in China but what is happening in other countries, said WHO Chief Tedros Adhanom Ghebreyesus, making the announcement at a press conference in Geneva. The concern is that it could spread to countries with weaker health systems. This breaking news story is being updated and more details will be published shortly. You can receive breaking news on a smartphone or tablet via the BBC News app.
This post received a score of 115,610, with an upvote ratio of 93%. Here are the top comments in response to this article.
NCOV confirmed cases, 9,841. NCOV deaths, 213. NCOV recovered, 171. NCOV suspected, 15,238. Updating this comment regularly with the latest stats. Useful resources. GCAT of case map over past 7 days, source. Comparing 2019 NCOV to SARS and 2009 swine flu, source. Suspected hash of cases vs confirmed cases, source. WHO press conference declaring PHEIC. Case map by Redditors, source. BNO News case tracker. Johns Hopkins case map. Coronaviruscases.org, source. TheWuhanVirus.com. 2019-2.
Cases currently at 8,287 worldwide with 171 dead. Edit. Obviously the real numbers are higher. If you're having that thought, it's not original. 1,370 are in serious or critical condition.
Jesus, if those worsen, the fatality rate on this does not seem encouraging.
Don't forget that most of them are in China, being dealt with in severely overcrowded hospitals with supplies that have been running out, and far lower quality of healthcare to begin with. I'm not saying it isn't bad, but don't start panicking yet. And if it hits the US, for example, at the same rate, wouldn't we have the overcrowding issue? If it infects the same 15 millimeters as the flu, are we set up for that? I'm not panicking, but it's something to consider.
Definitely. I work at a hospital, and when flu season is going strong we frequently fill up and have to try and divert patients to other hospitals which are equally as full. They end up just holding patients in the ER or PACU until rooms become available. It's a nightmare. Then they have to keep staff longer hours caring for patients, and it puts a huge strain on the entire hospitals.
Studies have shown that holding patients in the ER as opposed to in the hallways of inpatient units significantly increases mortality rates in those patients.
Do the studies attempt to look for causation? I'm pretty sure that under any circumstance, the rate of death in the ER is greater than the rate of death within inpatient hallways. A lot of people die in the ER. Someone can do a study showing that once someone enters a nursing home their mortality rate goes up, but I wouldn't blame the nursing homes.
It's almost as if the ER was for patients in an emergency. The main criteria that tipped the scale was not the number of people infected or the amount of deaths. It was the virus's ability to spread after arriving in a new country through human-to-human contact.
Isn't this how every virus works?
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.